So permit me to invite distinguished Excellency, distinguished Senator Ipalibo Banigo, Chair, Senate Committee on Health, to deliver a keynote address. Your Excellency.
There is nothing like sweet memories. Let me recognize my dear sister, the President of the Healthcare Federation of Nigeria, and the Vice Presidents and the ESCO, and of course also the Executive Secretary. And let me also recognize my dear sister, the former President, Dr. Pamela Ajayi, who was the first person to introduce HFN to me 2 years ago. Unfortunately, I couldn't come for those occasions. And I'm happy, I'm delighted I'm here today. Let me recognize all the distinguished personalities here. I wouldn't be able to take them on one by one, but particularly those who have joined us from our neighboring, from our countries, our sister countries, from Gambia, from Ghana, from Senegal, in Gambia, and from Egypt. You're really welcome to Nigeria. We're happy to have you here. We hope you really enjoy your stay here. Of course, former chairman of the 9th Assembly, National Assembly, the chairman of the Committee on Health, Dr. Lorigbe, and all our wonderful HFN partners, those who are in the business of actually doing the private practice that is effective and effectual across the country. And our partners, the WHX Lagos, West Africa, that is partnering this great event. This is wonderful. I see some of my friends from River State looking up at me here. Okay, so thank you very much. It's a great delight for you to have invited me on this very auspicious occasion of your 10th anniversary of Healthcare Federation of Nigeria. Can you please give yourself a really huge clap? Really, really huge clap. You are what we say, you've really broken the ceiling. You've made private service, private healthcare delivery more visible in a very positive way. You've let us know that the public sector, the public health delivery system, if we are going to achieve any proper health reforms and health policies that will touch the lives of all Nigerians everywhere they are and anywhere they are, we have to work with the private sector. After all, you take care of such a huge percentage of our people across the country. And so you have been able to put this system together year after year, and each year it keeps on getting better. I congratulate you, and I congratulate the new executives. Thank you very much. I want to say that truly and truly, we are at a very important, very pivotal place in our health services, because the Nigerian health system finds itself on one side. We're grappling with deeply entrenched challenges, chronic underfunding compared to global benchmarks, fragmented services, a worrying drain of our healthcare professionals, and a heavy burden of preventable diseases. On the other hand, we possess immense strengths, a dynamic and innovative private health sector, rapidly expanding digital infrastructure, and we do have a fresh political will to drive reform, health sector reform, and drive a health sector policy that works for everybody. The real work now is to forge a powerful synergy, a deliberate and sustained public-private integration built upon solid policy, clear accountability, and shared success. So what is the imperative for integration? As both a health professional and a legislator, I can tell you unequivocally, integration is not a theoretical concept to debate. It's an absolute necessity for our nation's finances and for delivering care to our peoples. The private sector already delivers the lion's share of health services, while the public sector sets the rules. This artificial wall between them cripples our collective ability to serve every Nigerian effectively. Proper integration, therefore, will unlock immense potential, enabling, first of all, strategic purchasing and pooled resources for maximum impact. It will also enable accelerated innovation, particularly in primary care and diagnostics, where we need it most. It will also enable equity-driven expansion, ensuring that rural and vulnerable populations are never left behind. It will also enable economic efficiency, cutting out duplication, and optimizing our invaluable workforce. So when we talk about, that's why the imperative for integration, it's not just theoretical, it's necessity, and it is for the now. When we talk about collaboration, collaboration is not outsourcing. It is important to understand that when we're talking about integration, it's not about government shirking its responsibility, but it's about a governed collaboration. We're already seeing such powerful examples. For example, some have started emerging. The inclusion of private providers in the National Health Insurance Authority coverage schemes. We are seeing such examples in the joint service delivery initiatives under the Basic Healthcare Provision Fund. We are seeing such examples in the public incentives boosting private digital health solutions and telemedicine platforms. And also in the harmonized training frameworks for our nurses, midwives, and frontline health workers. I wish to put to you that my commitment to legislate for a healthier Nigeria, I'm very passionate about it. As the chair of the Senate Committee on Health, Secondary and Tertiary Services, I am dedicated to using legislation as a powerful tool for reform, for health reform. And allow me to share some critical aspects of our recent and ongoing work. Number one, in embracing digital health, inspired by the ECOWAS Health Committee meeting, I am championing relentlessly the adoption of digital tools, including telemedicine, to expand access and enhance health education, especially in our rural communities, and fast-track our journey towards universal health coverage by developing digitalized health information systems, which will have an effective community monitoring evaluation mechanisms. In tackling stillbirths with data, very important, Nigeria's stillbirth burden is heartbreakingly high. Many of us don't know because it seems to be hidden. My office collaborated with IHVN to launch a national stillbirth dashboard under the SPEED project, which provides real-time data that empowers policymakers and frontline workers to implement targeted, evidence-based interventions. In strengthening the community health insurance through my Bringing Healthcare Home initiative in Rivers West Senatorial District, I partnered with the National Health Insurance Authority to extend inclusive coverage to vulnerable groups across 8 local government areas of my senatorial district, covering over 6,700 constituents, shielding them from catastrophic health expenses and improving outcomes, health outcomes across the district. I have also been advocating for maternal support in the sense that among the bills I have sponsored is one that provides a crucial amendment to the Labor Act, seeking to extend maternity leave from 6 months to 6 weeks to 8 weeks. You know, it used to be 6 weeks before and 6 weeks after. So my bill advocated for amendment to increase it from 6 to 8 weeks with full salary maintained. Now, this is a vital step for maternal health, allows the mother to spend more time with her baby, her newborn baby, have exclusive breastfeeding, take off properly, and it is a vital step for gender equity. Also, it aligns Nigeria with international labor standards. We have made oversights in our 10th National Assembly Health Committee, a very vibrant and robust one, very vigilant oversight on infrastructure and services. Our oversight role is active and responsive. Just for one example, let me take University of Port Harcourt Teaching Hospital, which I have closely monitored the progress on key projects like the emergency medical treatment block and residential quarters for the staff and the residential quarters for residents, those doctors that are doing their residency programs, pushing for their swift completion to enhance both patient care and staff welfare. In securing energy subsidies for hospitals, in line with my previous advocacy on the Electricity Act, I do applaud President Tinubu, our president's recent approval of a 50% electricity subsidy for public hospitals. This policy will dramatically reduce operational costs, improve service delivery, and ultimately ease the financial burden on our patients. In championing legislative accountability, at the 5th Annual Legislative Health Summit, which was held last year, I underscored the critical role of legislative leadership in achieving universal health coverage, advocating for increased budgetary allocations, strengthening oversight, and putting in place a system of digital innovations like telemedicine. Also, in strengthening bilateral and multilateral health workforce mitigation on brain drain. I have advocated at the Global Health Advocacy Incubator for a structured bilateral and multilateral agreement to ensure that there is ethical recruitment practices across nations, between Nigeria and other countries, that our health staff, our health professionals go to. And also locally here in Nigeria, the move to increase the years of service that our medical professional can stay in service before they retire, and increase their compensation also for all our health workers. These actions are not isolated. They are deeply rooted in the aspirations of our citizens, in the expertise of health economists, and in the proven best practices from nations that have successfully bridged the gap between policy and performance. I want to say that we will always work closely with the Healthcare Federation of Nigeria. We will work with them because they are providing for our private sector, and we will participate with them in whatever they are doing. Their bill for, an agency that will strengthen them better. We would like to know more about this so that we can help you give all the advocacy and support you need, because we want to enhance your participation. And all other civil society organizations, we have decided that we'll always work with you. The last time we had a Legislative Health Summit, we had a role for you to play there. In the next one we are going to have in October, we'll have an even greater role for you to play in that summit. So this is a call to action for all stakeholders. I want to say that the private sector must evolve from a passive observer to an indispensable strategic partner. I don't want you to just see yourselves as being there doing your work. You said you were in the field, in the compound. Then you have now been brought to the table. On the table, I want you to see yourself as indispensable strategic partners. Please. Government must transform also from being a regulator, just a regulator, policy maker, to being a dynamic enabler. Not just about making the policy, but providing the enabling environment where all those who are on the table with us can participate and contribute positively. Government cannot do it alone. And our development partners must collaborate with us to co-create systems that are robust, adaptable, and truly sustainable. Sustainable in enhanced language. We need to have that system collaboration that provides sustainability so that Nigerians will continue to have the best of health services from the length to breadth of this nation. Above all, we, your legislators, will continue to bridge the gap between a political will and structural health reforms through laws that empower integration, through budgets that genuinely reflect our national priorities, and through oversight that ensures that every plan becomes a reality. In my humble journey from a practicing medical doctor to the deputy governor and now as a legislator, I have witnessed firsthand that no health system can thrive in isolation. Our path forward must be firmly rooted in collaboration, inclusion, and strategic foresight, in trust, integrity, and accountability. Let this conference be a powerful reaffirmation of our collective commitment to building a health system that works for every Nigerian and works for those who live in Nigeria also, in every part of this great country. I want to wish Healthcare Federation of Nigeria and WHX Labs Lagos and all their partners very successful and fruitful Leadership Conference 2025. Thank you all, and may God bless the Federal Republic of Nigeria.